Now we're going to get to the main event because you don't want to hear me talk all night. So I'm going to turn everything over to Jen from Birth and Beyond. And thank you for joining us tonight, Jen.
Thank you. And can you see my screen?
Yes, we can.
Wonderful. Okay. Okay, so like she said, I am Jen, and a little bit about myself. I am a mother of 4 kids. I did say before, and I'll just reiterate it, that at any point, any one of them can come in here. Hopefully they'll be clothed, because sometimes there'll be like a naked hiney in the background here. But my husband is home, so he's trying to keep them out of the room. So hopefully we won't have any interruptions. I am a birth and postpartum doula and a childbirth educator. And I also train new doulas and new educators. And my business is the Village Sprout, but I am CEO of Birth and Beyond Resources, and we support families during pregnancy, birth, and postpartum by providing resources and personal and financial support. So Birth and Beyond Resources is a nonprofit 501c3 organization. Okay. This PowerPoint will also be available to you with the clickable links. So anything that I can't cover today, there'll be links on this PowerPoint. And I know that Crystal said that she'd make it available to anyone who is watching tonight. So what we're going to cover today, we're going to talk about what to expect postpartum. We're going to talk about PMADs, which you might have heard of. It's most commonly talked about as postpartum depression, but there are more and more people that are opening up to there's other things that can happen postpartum. So we're going to talk a little bit about those and what to look for and what to be aware of. That actually just stands for perinatal mood and anxiety disorders, because they can occur at any point during your pregnancy and up to a year postpartum. And then we're going to talk about some resources for support and some newborn and infant care. So why do we call it the 4th trimester? We like to call our postpartum period the 4th trimester because you will likely still be attached to your baby, just in a different way. Some say that babies are so attached to their mothers because they still think that they are the same person, which I think is just such a sweet thing. We will talk about some things that we want you to be prepared for during this period. So rest, right? Your body has been through a lot, even if you had a short labor, which I wish on everybody, but not too short because that can be jogging. But your body still needs time to rest in the first few weeks following the delivery. The age-old, sleep when your baby sleeps might not sound realistic, but rest when your baby sleeps is. If you slept every time your baby slept in those first few weeks, you'd be sleeping probably 18 hours out of your day. So, just resting when your baby sleeps. You could expect sweats. This doesn't happen all the time. Like I said, had 4 children, and probably about 50% of my postpartum periods were filled with sweats in the bed. Just all of that extra fluid that you've been carrying around is going to shed in those first few nights. You might just wake up in a pool of sweat. It's very normal. But remember that you're shedding this fluid, you also need to remain hydrated. So drink a lot of water. There's also something called Lochia. So your blood volume increased by 60% during your pregnancy. This might be sometimes why women say that they get like cankles, your ankles are swollen, or your fingers are swollen, because all of this increased blood volume is pooling in your extremities. And you can help that, by increasing your protein intake and trying to get that pressure to move that blood volume through your extremities. I am like dipping into my educator hat for my birth classes, but once you have the baby, you're going to be shedding all of this, right? So you also grew a significant amount of tissue, which will now shed in the next several weeks. You will most likely have period-like bleeding for the first 3 to 7 days, and it will continue lightly for the next 6 weeks. Some women swear that Depends type underwear is a must, while others are fine with just overnight pads. I am the overnight pad lady. I don't get the Depends. I don't understand. You have to take the whole thing off. Yeah, it just never was my thing. But I know I have friends that say that that was the number one thing that they had to get for their postpartum time. So you want to contact your provider if you're soaking more than 1 pad an hour, or if you pass a clot bigger than a golf ball. You might also experience something called afterbirth contractions. This is more common if you've had 2 or more births. And I also have seen it where, so my first birth was a cesarean and my second birth was a vaginal birth. I didn't have afterbirth contractions until my 3rd birth. So since my first birth wasn't a vaginal birth, I feel like I skipped over to the 3rd birth where I got the joy of the afterbirth contractions. This happens because your uterus contracts during your labor, right? To get that baby to come down and out. Well, after birth, we want your uterus to continue to constrict and contract down because we want it to get back to a pear shape. Also, you know that once you expel your placenta, where the placenta was attached is a big open wound in your uterus. So the quicker we get it to constrict down, the less blood that you lose postpartum. So we want it to contract down. So this is a good thing. These contractions are not as intense as labor, but they can still pack a punch. So just take a moment to breathe through them. The uterus returns to the pear shape with these contractions, and it can take about 6 weeks. Again, if you have any questions, please throw them into the chat and I will answer them as they come up. So activities, right? So, getting back to your normal schedule. Wait until you've spoken to your provider about resuming exercise or sexual intercourse because, even though you might be physically ready for these things, you might still need more time mentally and emotionally. So we just suggest to keep the communication lines open with your partner, let them know how much you appreciate their love and understanding, but make sure you definitely talk to your provider before resuming these activities. So nutrition. So if you're breastfeeding, you are still eating for 2. So try eating warm and easy to eat foods, root vegetables, continue taking your prenatals because your body still needs those nutrients. You're still giving that to your baby. Bowels. Okay, so it might be difficult after birth to even think about pushing anything more out of your bum, but poop happens. If you're one of these people, try eating fiber nutritious foods and talk to your provider about anything if it gets to a point where it's really not if you're really in pain. If you're dealing with hemorrhoids, you can pre-make pads. You might have heard of these padsicles or any type of these different pads to soothe, right? We suggest soaking little pads in milk of magnesia and freezing them. That was a good trick we got from one of the home birth midwives here on Long Island. But you can also try witch hazel on a pad and freezing that and putting it into your Depends or onto your pad. Perinatal care, so just taking care of your perineum after birth. If you've experienced a tear or an episiotomy, you can ease this discomfort with some warm sitz bath. You can also pour the warm herbs. We really like the herb comfrey, which is a very healing herb, and you could just heat it up and then pour it right on your fresh pad and apply it to your perineum to help the healing process. Some also prefer cold pads instead. I would say if it's immediately after birth and there's swelling, you want to probably use cold, and then after that, you might decide to go to warm. We also highly suggest Manuka honey or coconut oil, and that you just put that directly on your perineum to help the healing process. Okay, so let's talk about emotions after birth. About 85% of women, which is a lot, report feeling emotional after the baby is born. We believe that this is because of hormonal changes, physical discomforts, fatigue, or sleep deprivation, traumatic birth or a birth that didn't go as hoped, a new body, a new routine. Any of these things can really interfere with your state. The most important thing is to be able to differentiate between what we would call baby blues from perinatal mood or an anxiety disorder. The biggest things to consider are how long you are experiencing it, how intense it is, and how often it is. And we'll talk a little bit more about it. If you have a partner, you want to talk to them about taking some responsibility to help detect whether or not you're experiencing a PMAD. We have a check-in list that will be linked on this slideshow. So it's really kind of easy to go through. It's not a diagnostic tool. It's just kind of a heads up. This is what's going on, that you can then make the calls and get help. Postpartum mood and anxiety disorders are common, but if they aren't treated, they can become chronic depression. So a quick side story, when I had my first baby, it was a very traumatic birth for me, but I didn't realize that it was affecting me until I was pregnant with my fourth, and it kind of all came back to me. So I didn't get any help, so then I was at a higher risk for experiencing a PMAD in subsequent births. 1 in 5 women experience a PMAD, but what most people don't realize is that 1 in 10 partners also experience some sort of PMAD. So just being in tune with your partner and noticing anything out of the normal is important. Here are the differences, the biggest differences between normal baby blues, which you'll see in 85% of the time, and 1 in 5 women experiencing a perinatal mood or anxiety disorders. So baby blues last maybe a few days to a few weeks. A perinatal mood or anxiety disorder, it lasts for longer than 2 weeks. Baby blues doesn't really disrupt your daily activities, but PMADs interfere with your day-to-day. Baby blues doesn't interfere with your sleep, and PMADs does. You might not sleep even if you're able to. Baby blues, feeling down, depressed. PMAD, persistent sadness, anxiety, or rage. Baby blues, you still do basic self-care and baby care, but in a PMAD, you might have little self-care or baby care initiative. So 1 in 5 women will experience a PMAD during their pregnancy or postpartum period, and 1 in 10 partners can also experience a mood or anxiety disorder. This can present as depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, panic, bipolar disorder, or psychosis. If you have factors that make you high risk, you are 50 to 80% more likely to experience a PMAD. With help, you can reduce this likelihood to 10%. So for a full list of risk factors and steps to wellness, you can follow this link and it will bring you right to a form. And this is the other form I was telling you about, the check-in form. To help facilitate a conversation about postpartum disorders, you can use the check-in form. We suggest that you fill it out about 4 weeks postpartum if you're still not feeling yourself, and share it with someone you trust. It isn't intended to diagnose mood or anxiety disorders. It's just there to kind of shed light on, let's see if we can take a quick look at it. Yeah, it's just there to kind of shed light. So, you know, if you check off a lot of these purple here, you might be experiencing postpartum depression. If you are checking off a lot in the pink area, you might be experiencing postpartum anxiety. So those are just some examples of what you'll see on that form. I think it's helpful because, you know, for me, I had no idea what I was going through. And I have a question, just a second. I had no idea what I was going through, and I was really, feeling very isolated and scared and alone. I was scared to reach out and get help. I was scared that I was going to lose my baby. If I had a form like this just to check off and give it to someone like my sister that I would trust to do the right thing with it, my postpartum experience would be so different. So the question from the chat is, do you have any experience or knowledge about ketamine infusion therapy for PPD? Crystal, very little. I actually went and got interviewed for this type of therapy when it was, I guess, in its early stages of approval. And, you know, I guess what I understood from it was that you had to be separated from your child and you weren't able to continue breastfeeding in order to get this treatment, if it is what I'm thinking of, but very little. So I wouldn't really be able to speak to it intelligently. Okay, let's make sure that okay. So let's talk about postpartum planning, because one of those things you're going to look at is going to say, okay, well, you have all these different things that are going on. Steps to wellness, really one of the biggest things is planning your postpartum so that if something, you know, you're prepared for this, you're prepared for different things that could happen, and you're setting yourself up with a good support system along the way. So it's so crucial that you plan your postpartum and not just your birth. You know, I know some of us who are watching this are still pregnant and they haven't given birth yet. So you might have taken some sort of birth education course. It's important, especially if they didn't include anything about postpartum in that birth education course, that you also, you know, read up a lot on postpartum and how to build yourself a good postpartum plan. Birth is a day, you know, or two sometimes, but your postpartum is a whole year. So we really need to think about planning that out well. If you can protect at least the first 3 to 7 days, it can greatly improve your mindset during the rest of your postpartum. So that means, like, we don't even want your feet to barely hit the floor. And this might sound like, I can't, this is no way I can get this done. I have other children, I have responsibilities, I got this, I got that, I got this. But I mean, America is the only country that is so behind in postpartum. You know, there are other countries that it's 40 days. I mean, the first 40 days, you're not allowed to really leave your bed. You're just there with your baby and just nourishing your baby while others nourish you. Sounds wonderful, doesn't it? But we're just saying, we're putting the American spin on it and saying just 3 to 7 days. Don't leave your bed. It takes some planning, obviously, much support from your community and family. It might also take some budget adjustments, so it's best to plan for that beforehand. This link here is an example of what you want to include in your postpartum plan, as well as a budgeting tool. Let me click on that really quick so we can take a look, so we have some time. So you're gonna put your budget in here. How much money can you spend on your postpartum time? This might be zero. You might not have a budget. If you don't have a budget, then you're going to employ some of your friends and family members to do some of these things for you. So setting up your postpartum space, you know, where are you going to be with baby in that first 40 days, right? So choosing a room within your home that you feel very comfortable with, you know, declutter it, you know, maybe paint the walls of common clutter, set up a basket, you know, all these different things, maybe a mini fridge. minimize your out-of-home commitments. Try to put together a basket to make breastfeeding easier if you're planning on breastfeeding. Build a library of postpartum reads. We really love the book, The First 40 Days. It's chock full of really great recipes that we were talking about before. You know, those root vegetables, the warm foods, that's chock full of those type of recipes that are great for you. We also love The Womanly Art of Breastfeeding. That's from La Leche League. So just kind of getting yourself a library of postpartum reads. Prepare freezer-friendly meals. So not just for dinner, because if you just have dinner meals, what are you going to do for yourself breakfast and lunch when you're trying to, you know, juggle everything else? You have to feed yourself 3 times a day. Consider going dark, sign up for a Mama Moon. And I was talking to Jessica about that before everyone joined. Mama Moon is a program from Birth and Beyond Resources. You go right onto our website, you sign up for it. You can sign up for it when you're pregnant. And once the baby is here, then you let us know that the baby is here. We bring you your favorite drink, we bring you your favorite snack, we bring you some flowers, and we bring you a little care package that's built by businesses from this community. So we also connect you with 2 volunteers who are well trained, and we just kind of connect with you through text messaging, and sometimes we've done phone calls, video calls with new parents. So it's a great program. So if you're interested, that's on our website. Maybe going to a local La Leche meeting, planning for your own self-care. So like maybe a postpartum massage or a chiropractic adjustment, acupuncture, talk therapy. Planning for older sibling projects, appoint a postpartum coordinator. I love this. I mean, and I know I have a few people in my life that would love to take on that role. So for me, it was my sister, you know, and she would take on this role. She'll take my plan, she'll take my budget, and she'll help me do all these things. Hire a postpartum doula. It's a wonderful thing to have. You know, a birth doula is someone that helps you and supports you through your labor. A postpartum doula is someone that helps you and supports you throughout your postpartum time, usually those first few weeks. And if it's in your budget, arranging for housekeeping. And we also put obviously that postpartum check-in list there too, and also taking a snapshot of your postpartum inventory, right? So who is available for you? Who can you call to talk about your birth story, to process your birth story? Well, I would love to hear it. So you could put Jen Barry down there, and that cost is $0 because I listened to your birth story, whether you paid me or not. So you want to put these support people in here and have all of these things covered for yourself. So that's just an example of a postpartum plan, but you can look online. You can look on, I think a great place to look up that is Pinterest. Pinterest has some great links. All right, so we're going to transition from your postpartum and taking care of you to taking care of that delicious little babushka, the newborn baby. So separating the cord, more commonly known as cord cutting, cutting the cord. I had 2 home births. So this picture you see here is my Marley Moose. We decided, because we were having the baby at born, that we were going to separate the cord by way of burning the cord. This is like a beautiful ceremony that we did with 2 candles, one my husband was holding, one I was holding. And this is done in third world countries because they didn't have sterile equipment, sterile scissors. So they were cutting the cord and babies were dying from infection. So the flame is actually very sterile and cauterizes it, and it's a very clean way of doing it, but it's also kind of pretty. We sang happy birthday to her with my other children at the same time. However, most of us go by way of cutting the cord in a hospital setting. However you do it, wait for the baby's blood to get to the baby before you separate the cord. Because when that baby is born, 1/3 of their blood is still in the placenta. So if we cut it prematurely, they're not getting all of that. That's their blood. It's meant for them. So if we cut it prematurely, they don't get all that extra blood. When we do delayed cord separation, we see that there's an increase of oxygen that goes to the tissues, as well as it acts as a clotting agent. So some of you might be aware that, oh, Crystal, that's wonderful. Yeah. Some of you might be aware of, when baby is born, there's a vitamin K shot that's offered, and that is to help the blood clot in case of emergency. So this delayed cord separation also helps, and it is a blood clotting agent. And it's something that great question. I was just going to say something that we would wait at least 60 seconds. And I say 60 seconds because that's what you can talk about to your provider, because that's what the American College of Obstetrics and Gynecology says, at least 60 seconds. So even if you are having a cesarean birth or a vaginal birth or what have you, they should at least give you 60 seconds. However, if your provider is super cool and they're like, whatever you want to do, you want to wait to sever the cord until it stops pulsing. When it stops pulsing, you'll see that the cord turns white. You can see that here in the picture. This was 2 hours after she was born. She was still connected. So we wait till it stops pulsing. Be wary of cord banking businesses claiming that you can delay the separation of the cord cutting and bank your cord blood. The provider will most likely want to separate the cord prematurely to make sure that they get the right amount of cord blood to bank, okay? Because everyone's getting a piece of that pie. If you sign a cord banking business, the provider that you're with gets a piece of that. So they want to make sure that they really cut it in time. Quite honestly, that blood is for that baby right then and there. That baby needs that blood right then and there. So cord banking, in my opinion, is not worth the money. That being said, my first baby's cord blood is banked somewhere. They're holding it hostage. So back then I made that decision, but it is a business, right? After the cord is separated, the care is simple. Don't do anything. Keep it dry and it will fall off in a few days. Don't do anything funny. Don't try to put oils on it or anything like that. Just keep it dry and it will fall off. Okie dokie. So Vernix. Vernix is that cheesy-like substance that some babies are born with. Most of all, if you have a baby post-term, post 40 weeks, past 40 weeks, then they usually don't have much Vernix left on them. This picture here is of my fourth, Miss Marley. She's so fat, I love it. She was like Guinness Book of World Records Vernix. You can see it like caked on her skin. She was 40 plus 5 too, so nobody knew what was going on. But don't bathe that baby right away. Some babies are born with this Vernix, like we said. It's a thick, cheesy-like substance. It acts as a barrier to help regulate their temperature, and it decreases the risk of infection. It's like a barrier on that baby. It has antioxidants in it like vitamin E and melanin, which may help in coping with the new environment outside of the womb. So instead of wiping it off, rub it in. It's the world's best moisturizer. Now, if you're having a hospital birth, they're going to want to bathe that baby and wipe that baby right away. Make sure you have a great plan in place, a birth plan that talks about this, and you talk to your provider and you talk to the nurses that you want to do that. You want to bathe your baby when you have your baby home. You know, babies don't really get too messy, right? So they don't really need that much in that first couple of weeks. I think Marley's first official bath was when she was like 4 months old. But you can do that bath at home using your soap and stuff. So don't bathe that baby in the hospital if you can help it. So let's talk a little bit about skin to skin. Evidence supports immediate, uninterrupted skin to skin care for all stable mothers and babies, regardless of feeding preference. This even goes for if you do have a cesarean, ask them if they could not tie your hands down to either sides, because that is normal, right? My cesarean baby is holding my fourth baby right here in this picture. My hands were tied down to the sides, and I really didn't get to hold her in that first couple of hours. But now I know better. I know that if that same situation were to happen, I could say, I don't want my hands tied down. If that was needed to happen, then I would have someone hold the baby to my chest for me. But yeah, in any really scenario, you should be getting that skin to skin right away. Let's talk about why. So skin to skin babies have cried less, they had enhanced cardiorespiratory stability, including oxygen saturation levels, and had more stable blood glucose levels. Skin to skin regulates the newborn's temperature as the maternal breast quickly adjusts depending on the individual baby's need. So let me just talk about that for a second. You have twin babies, right? Baby A, baby B on both your breasts. Baby B's temperature needs to be 2 degrees higher, and baby A needs to be 1 degree lower. Your breast will heat up to that baby's needs. That's how smart our body is, and they will do what they need to do for that baby's needs. So cool. Skin to skin also awakens the breastfeeding reflexes in the mother, and mothers that had skin to skin with baby showed increased sensitivity to their babies later, and also showed a reduction in postpartum anxiety, depression, and pain. And we are also talking about skin to skin with siblings, as you can see here in the picture, and partners also have huge benefits. They've just started doing research on skin to skin with partners and not yet on siblings. But that connection, it kind of rewires, we'll talk about it in a second, but it rewires their brain to have more of a connection. So I usually say the partner should get at least a half an hour of skin to skin with that baby every day in the beginning days. I'm gonna dab into breastfeeding a little bit. I know it's not for everybody. I'm hoping that everyone here chooses to try, and that you feel comfortable leaning on me. My cell phone number will be at the end of this. If you have questions or you need help, it's not easy. I know we said skin to skin awakens the breastfeeding reflexes in the mother. However, we don't have an instinct to nurse as mothers, right? Your baby has an instinct to find food, and they know that they can, you know, crawl to your breast and get food, but mothers don't necessarily have that instinct to know how to do it, right? One of the biggest hurdles in the beginning can be learning that, how to do that. And one of the greatest issues that we see is the mother's lack of confidence, and that's usually because of a lack of support. And sometimes also, if your birth doesn't go to plan, it can affect your confidence as well. So if you had like this cascade of interventions during your birth and you're feeling awful and it was traumatic, and then you're trying to get that breastfeeding relation to get jump started, and that doesn't work also, it just is a cascade of waterfall events. I wanted to put this picture here because I think it's really important to remember how big your baby's belly is day 1, day 3, day 7, day 30. It doesn't take much to fill them up. And I usually say that breast milk is a lot like Chinese food because Chinese food is easily digested. I don't know if any of you eat Chinese food, but I know when I eat Chinese food, I'm like, I'm so full, right? And then 10 minutes later, I'm starving again. It's easily digested. So you're feeding your baby and then they're full, they're satiated, they're totally, boobed out. And then like a half an hour later, they're up again. They want more food. It's so normal because they've already, they have a small belly, they were satiated, they already were able to process it, and then they want more. So that's all very normal. So expect that, and know that if you spend entire days on your couch and you do nothing else but breastfeed your baby and change your baby and eat also in the mix of things, that you have done so much, and it's so good. Couple things here with successfully starting breastfeed, some things you can do now, going to a breastfeeding class. Actually, Birth and Beyond Resources has a breastfeeding workshop. If you're interested, it's virtual, so you can sign up for it right on our website. Find a local La Leche League chapter. There's a wonderful one that I had made friends for life from at Patchogue-Medford Library. Attend that while you're pregnant. Connect with a quality lactation professional who you can reach out to, who is well-versed in tongue and lip ties. Protect that golden hour, that first hour of your baby being here by maximizing skin to skin and bonding. That also shows an increase in breastfeeding success. And let that baby do the work, right? Let them lead the latch. They already got the instinct. You don't know what's going on. It's their instinct to find the food. So let them do it. Let them find the boob. Let them latch on their own without you helping them at all. That's what's going to get a perfect latch. And another really big concern for new parents is my baby getting enough milk? So these are my best things of advice I can give you is be confident. Your body knows how to do this, right? Supply and demand. Remember I said, like, baby would be, eat, be so full, and then 15 minutes later, a half an hour later, want to eat again because their bellies are so small and they keep processing it quickly, and it goes. But also you'll have things that people sometimes refer to as growth spurts, because your baby is super smart, and so are your breasts. So your baby will latch on and chomp, signal, milk. And then they'll stop and they'll say, no, we need more milk. So signal, more milk. It's supply and demand. So they'll go through a day where you're like, this is all I've been doing is feeding. Well, your baby is trying to signal your breast saying, I'm growing, right? So I need you to make more. Super smart system that it's going on here. But even if you could look at baby's clothes go from newborn to 0 to 3 to 3 to 6 to 6 to 9 to 9 to 12, and you get to 1 year, and all of a sudden it's like, all right, we're done growing, so we're going to give you another clothes at maybe 18 months, and then 2 years, and then from 2 years it's going to be 3 years. And so their first 6 months, they're growing so fast, so rapidly, that they do need to signal you to make more through their journey. If you have a sleepy baby, those babies, maybe you get one of those babies that sleeps a lot, you have to wake them up every 3 to 4 hours, especially if you're concerned about their weight gain. I usually say new babies, they're a lot like lazy teenagers. They just sleep all the time. But you got to wake them up to make sure that they get enough food. Their wet diaper output, and this is going to be easy for you to remember, right? Should be at least 1 for every day of life until day 6. So day 1, 1 wet diaper. Day 2, 2 wet diapers. Day 3, 3. Day 4, 4. Day 5, 5. Day 6, 6. And after that, it will average 6 to 10 wet diapers. But no, when I say 1 day of life, I mean a full 24 hours. You're looking for 1 wet diaper in that first day. So don't let it upset you. We're not as concerned with stool, especially with a breastfed baby, but they do need to pass that dark, sticky meconium in the first few days. After that, it turns to about a greenish type of stool. And then finally, a mustardy, seedy stool, which is not offensive at all. It's actually super sweet to smell. And probably one of my selfish reasons for breastfeeding is because babies' diapers from breastfed milk are not offensive. They do not stink. And then lastly, this is like a a secret, right? Look at your baby's hands after they are done feeding. If they're clenched, even if that baby is sleeping, they aren't done eating. They're lazy. Wake them up. Do whatever you can do to wake them up. But if they've done and they come off and their hands are wide open and they're totally blissed out, they're good. You can put them down. You can let them go, because that means that they have gotten all of what they need. I also loved my breastfed baby's poops in a weird mother, only I guess mother way that you could love your baby's poops. All right, so now we're going to transition into some expert solutions. So we talked to a bunch of new mamas and experienced mamas, and listen, an exclusively pumping mama is my freaking hero. I mean, that is like I think the most difficult thing to do is to exclusively pump. And I pumped, you know, at my job for more than a year in parking lots. I actually got pulled over by a cop, not pulled over, but I was in the way far end of the Smith Haven Mall parking lot and pumping during holiday, and a cop came over to my door, and here I am like, and he comes up to my window. I'm like, oh my gosh, I rolled down the window. Can I help you? He's like, what are you doing here? I'm pumping milk. And he's like, this is where drug deals happen. You need to go somewhere else. That was like one of my favorite stories, but pumping is not an easy thing to do. So I give you all the props. So we're going to transition into baby expert solutions. It's no secret that babies require a lot of care, especially in the first few weeks. Pair that up with new parents that aren't getting enough sleep, and it can feel like days and nights are melting together. You might also get one of those babies that mixes up their days with their nights. Almost all babies do it. And also know that baby's second and third night of sleep could be very difficult. They're going through so much during this time internally. So many times I hear my students and they go like, oh, our baby's amazing. Oh, they slept all day today. Oh, all the nurses are saying how our baby is amazing. And then they get home and they're like, what happened to our baby? Our baby has not stopped crying. They're so upset. Well, they go through so much internally. So I try to give you a heads up, like brace yourself for it. That second and third night, there's lots of things going on. So be prepared. So here are some of our expert solutions. The first one is, this is like a tip of all tips. This is one I love to share. I love to go on lactation visits and do this. And the person my client is just staring at me like, what, how are you doing this, right? We call it the magical womb, right? So it's 2 a.m., baby is crying. They've been changed, you fed, they're still upset. So put their head right in the nook of your neck. And once they're in this position, so you're holding your baby. I wish I had my Charlie, my little baby, that's not a real baby, but it's a baby doll, but it's packed already. So imagine I have this cute little baby right here and she's right up by my neck. Once they're in this position, hum, sing, talk while you sway back and forth. Doesn't even matter what you're saying. You could be like, I wish I was sleeping and not rocking you back and forth. It doesn't matter, because that position and the sound mimics the peaceful place where your baby spent the last 40+ weeks. And they almost always will soothe and maybe even fall back asleep. That vibration, you know, and I see it happen even better if you give that baby to a man who has that like very deep voice. It just sounds a lot like the womb. So it's like the perfect thing to do. Note, for some reason, you have to be standing for this technique to work. As soon as you sit down, baby is going to freak out. So you have to be standing, and you know, so is life. So let's talk about skin to skin. We already talked about it immediately after birth, but now we're going to talk about like those first few weeks. keeping that baby naked, right? If they're skin to skin with you, their temperature is regulated. You do not need to worry. Here is my baby with my husband doing some skin to skin. You can almost always calm a newborn baby down by getting down to the skin. You can one-up this by using what we would call kangaroo care, right? Which involves encompassing the two of you in a blanket. We've learned all about the benefits of skin to skin at birth, but by using this method beyond birth, it can help promote calmness. Partners and siblings can benefit greatly. Like I said before, it can rewire their brain and promote bonding. And there is, like I said, early research on this for your partner. Baby wearing, another top secret thing nobody told me about when I was having my first baby. Many new parents are surprised at how often babies like to be held, which sometimes can lead to frustration. I know that I was super frustrated with my baby, my first baby. I couldn't get anything done because she only wanted to be held. And until I found this magical thing called a ring sling. And I was like, oh my goodness, I could do everything and anything and hands-free and have this baby who's happier than a pig in poop, you know, just hanging out there, right? It's a safe and effective alternative to swaddling, belly sleeping, and lugging the car seat in and out of the store. So there are dangers to swaddling, right? And I think I might talk about it today. If I don't, and you're interested in that, we can talk about that more. There are dangers to belly sleeping. We know that we should be putting the baby on their back to sleep. And, you know, lugging the car seat in and out, gosh, I don't know why car seats have to be 1,000 pounds. I don't know why, but nobody wants to be lugging that car seat in and out of the car. So always having yourself some type of baby carrier that you can just throw that baby in and out for shopping and anywhere else, while leche meetings, whatever. So when you wear your baby, make sure that their airways are always not constricted in any way, and that they are high enough so you can kiss their head. So this is my second baby here. Her name is Dorothy, and you can see that she's high enough that I can kiss that sweet baby's head. The other thing I want to just point out is if you do have a ring sling carrier, you might be holding the baby in there like this. If a baby's head is too much far this way, like this, since their airways are so sensitive, it can actually cut off their air circulation. So you do not want to hold the baby like that. Their airways have to be open. I had a client once. I went to her house for a lactation visit, and she was holding the baby in this sling just that way. And when I peeked in, the baby's face was a different color, and I could tell that the baby wasn't getting enough oxygen. So I just took baby right out, and we got the baby, you know, back to color, and we made sure that we understood that. But you want to be really aware of that airway being open. Avoid carriers that don't allow for coverage knee to knee. So the fabric should be knee to knee. Your baby's knees, fabric should cover their whole bum, right? And their upper thighs. And avoid front-facing carriers, at least for the first 6 months. It's too much for a newborn baby to be outward in a carrier. And you might say like, oh, my baby loves to see the world. Well, what happens when they're overstimulated and they're like, I don't want to see any more of these people? They can't do anything because they're just out there. If they're facing inward, then they can just nuzzle into your breast and go to sleep. But forward-facing carriers don't allow for that. The baby dangler carriers, like the baby Bajoran, that's just cupping over their, you know, what we call them baby danglers, I don't know how else to say it, is really not good for the natural position of the baby's hips. So that's why we want to allow for coverage knee to knee. Our favorite carriers for beginners are pre-owned ring slings and soft structured carriers like the ergo, boba, tula. I say pre-owned ring slings because that material is also broken in already and buttery soft. And there are wonderful Facebook groups that have pre-owned wraps and ring slings and things that are super inexpensive, and they all ship for under 100. It's called Babywearing on a Budget. So all of the things listed on there. So there's literally like 500,000 people in the group. So if your favorite color was purple and you wanted a purple ring sling, you could put purple ring sling in, and you'd have yourself a carrier. Check out your local baby wearing meetings near you. There is one called Carry Long Island. You can become a member with them for, I think, like $15 for the year. And they have a whole library of carriers that you can take out and use for your own. So that's a very cool thing to do as well. All right, let's talk a little bit about upset bellies, because it's going to happen. Most always babies get upset bellies at one point or another. Sometimes it could be from dairy in the mother's diet if the baby is sensitive to whey protein. More times than not, they grow out of this sensitivity before you can efficiently take dairy out of your diet. So for me as a lactation counselor, I would never want to change a mother's diet because I just want you to eat. I don't care what it is. I don't care if it's a bag of Doritos, just eat. So don't try to like change your diet at all unless you see blood in your baby's stool. And that's a very true allergy, and that you need to act on. Most of the stuff is sensitivities, right? I know that if I have a newborn baby around the time of, say, St. Patrick's Day, and I have cabbage, that I'm going to get a little gas, and so is my baby. So they're going to experience some gas and reflux, maybe because of some of the things you eat that is really not avoidable, all right? Typically, though, breastfed babies shouldn't get any air with a good latch, but sometimes, especially with something we call tongue or a lip tie, they can experience not only gas, but something we call airphagia reflux, which is reflux caused by air. I really feel like if your baby has any type of reflux, please go look into a tongue or a lip tie first before putting them on medication, because 9 times out of 10, I even want to say 10 times out of 10, it's not acid reflux that's causing it, it's air reflux, aerophagia reflux, where they have a tie. So their tongue is maybe tied to the bottom of their mouth, or they have a lip tie, and that causes air to get in, and then they've spit it back up, okay? And that can easily be fixed. So this is our favorite position for gas, holding your baby upside down. So the baby's kind of looking down at the ground. Your palm of your hand is positioned right where their belly is. The baby should lay over your arm, facing downward, allowing the pressure from your palm to relieve the gas pain. And you get bonus points if you're standing and swaying. We'll talk a little bit about a diaper bag. I always like to throw this in there because there's no need for a fancy $300 diaper bag from, Bye Bye Baby. These big, bulky, bright diaper bags. So our suggestion is just investing in an oversized bag from like Target or Marshall's, or even some people like backpacks with some inside and outside pockets, and you can keep everything you need in one place. Always pack a few diapers. If you're doing cloth diapers, you want to also have a wet bag and wipes and a change of clothes. And I also throw in here, because I've been on a date with my husband and my baby where she had a blowout on herself and me, that you might also keep a change of clothes for you in your car. And baby-led weaning. This is just such a hidden treasure to find out about baby-led weaning before you introduce it to your children. The children that I have done baby-led weaning with have very healthy, very healthy eating habits. They, introduced to the rainbow at an early stage. And basically what it is they are just eating what you eat when they're ready for it. We still have pediatricians that are saying that our babies can have, rice cereal at 2 weeks, which is mind blowing, or, that they're ready to eat solids at 4 months. And as parents, we think this is like a milestone. So we're really excited to get them onto food. It's not a milestone, right? Plus their diapers will start to stink. And just a side note, food before the age of 6 months can cause damage because your baby's gut just isn't fully mature enough for solids. It's best to wait until the baby is showing signs of readiness after 6 months. So that includes bringing objects to mouth with intent, using the palmar grasp, the absence of the tongue thrust reflex, sitting independently for a minute, and showing interest in food. So if you're sitting at your table, you're having broccoli and chicken, and they reach over to your plate and they grab a broccoli, let them have it, as long as they have these other things going on. So try to stick to whole foods once they're ready, foods that add value to their diet. Hint, it's not rice cereal, it's not oatmeal. Those things are empty calories. So you want to have, whole foods, broccoli, sweet potato, any root vegetables, really what your diet was for your postpartum time. And then always check with your pediatrician for foods to avoid before the age of 1, like honey. And chiropractic care, another top secret parenting tool. We go to Dr. LaPerry in Holtzville. She's amazing, but there are a lot of amazing chiropractors here on Long Island that deal with newborns. This is Dr. LaPerry's office. That's my daughter, Dorothy, and my other daughter, Elsie, who's pretending to give her an adjustment. My kids have been seeing Dr. LaPerry since they're newborns. And chiropractors can really help with a lot of different things like sleep issues, breastfeeding dysfunction, torticollis, colic, and more. We have a chiropractor out west. I forget what town he's in. His name is Dr. Pape. And he says he is so good at getting babies to poop that they call him Dr. Poop, not Dr. Pape. So we have a quote here from Dr. Waters. Even in utero, if there was any sort of intrauterine constraint, the baby can get stuck in one position, potentially for several months. So wouldn't you be hurting if you'd been in one position for 2 months? From day 1, they can have directional preferences, possibly due to shortened tissues during growth. The goal of treatment is to restore motion to the joints and balance the tissues to keep everything as biomechanically even as possible. Taking the tension off from day 1 can help allow for optimal growth and development. I'm going to speed through here now because I'm at 7:30. Car seat safety. This is just a couple of different things you should be aware of with car seats. Make sure the car seat's not expired. Make sure that you rear face to the limits of your car seat, okay? Rear facing children have an 8% risk of severe injuries versus front facing children at 40% risk. You should be able to rear face up till at least 3 or 4 years old. And too many people are just, again, treating this as a milestone. The chest clip, I know this sounds weird, but it's designed to be positioned at the chest of the baby, even with their armpits. If the straps are placed too low, the child is not secure in the seat and it could damage the organs, right? Because you have your rib cage here, you don't have anything down here protecting your organs. So that chest clip has to be up here. Also make sure your straps are not twisted, and remove coats from the car seat because coats compress very easily, and then it gives you a false thought that your baby is in there snug and tight, but really it's not. So here we just say proper rear facing seats reduce injuries by 96%, making it 5 times safer for children under the age of 4. Okay, I'm going to zip through this a little bit. Reasons to call your pediatrician: excessive jaundice, baby isn't having enough wet diapers, blood or mucus in the bowel movements, baby's urine is orange or crystallized, umbilical cord looks swollen, baby is lethargic, baby has a bright green tongue, baby isn't having bowel movements, if baby feels too hot or too cold to the touch, baby isn't interested in feeding, and whenever your intuition tells you something is wrong, because your intuition is the greatest thing. We didn't go over quite everything today, but I've included a list of things to research on your own, such as breastfeeding, circumcision, co-sleeping, all other good things here, baby wearing, and so on and so forth. Also, if you haven't taken a childbirth education course, we have over 25 educators on Long Island doing in-person series, but we also have one virtually there. And there's my name, my email address, and my phone number. I'm very text friendly. You can text me right now. I'll text you right back. So if you have additional questions, I'm fully accessible and I love to talk about these things. So thank you all so much for popping on. I hope this was informative, and that's all I have. Thanks. Sorry, I
All
went
right.
over.
Thank you so much, Jen. For everybody who's in attendance, we will send out the slides to you guys, and in a few days, we'll have it up on our YouTube channel as well. So you'll be able to view the presentation and share with a friend. I want to thank you, everybody, for coming tonight, and thank you so much, Jen. Have a good night, everyone.
Thank you.